what is a capsular contracture around an implant? Now, sometimes when we do breast augmentations and we use an implant, the body creates sort of like a scar tissue capsule around the implant. And that happens at about 2 to 5%. And what it is, it's a scar tissue that occurs around the implant. And most implants have it. The problem occurs that when this capsule becomes hard or when it becomes very tight and when it contracts. So when it contracts, as you can see, it changes the shape of the implant. And we don't want that. Now, the capsular contracture is known to occur due to a very subclinical bacterial infection, meaning that there's a little bit of bacteria that has gone into or surrounding the pocket at the time of implant placement or sometimes afterwards. There are several techniques that we use in surgery to prevent this bacterial infection. So there are 5 main techniques. Number 1, we use obviously a sterile environment, scrubbing, prepping the breast, and we try to do something called the no-touch technique, which is what I'm going to talk about. So the first thing is we make sure that everything is sterile. Number 2, we cover the nipple at the time of surgery because most of the bacteria around the breast comes through the nipple ducts. So during surgery and during the breast augmentation procedure, we use a waterproof tegaderm or tape that we place on the nipple. And at the end of the procedure, we take this out, and this also minimizes bacterial infection. Number 3, the pocket is often irrigated with an antibiotic solution. So let's say we've started the procedure, we've made our incision, we've created the pocket. We then go in and irrigate the pocket with antibiotic solution. And once we've irrigated the pocket with antibiotic solution, we then place the implant in. Now, to place the implant in, there are 2 things that are very important. The implants, they come in a pre-packaged box. And the implants within this box have an electromagnetic charge. So if you open the box, immediately it attracts, dust, bacteria, whatever is around it, it'll attract it to the implant. So what we often do is while the implant is still in its box, we inject some antibiotic solution into it to coat the implant, and then we open the box, and that prevents bacterial contamination around the implant. Once the implant is swimming in this antibiotic solution, we use a funnel, so you're not touching the implant. The implant is placed directly into this funnel without actually touching it. So it goes from the box into the funnel and underneath the incision directly into the pocket. So these are the 5 ways that one can prevent capsular contractures to happen at the time of surgery: sterility, covering the nipple, washing the pocket with antibiotic solution, irrigating or coating the implant with antibiotic solution before opening the box, and finally a no-touch technique where the implant goes directly from the box into the funnel and into the pocket.